Hi everybody, Jennifer Blevin-Smith with Integral Clinic Solutions, and you're watching my YouTube channel, Navigating the Business of Medicine. Today I want to talk about durable medical equipment billing just briefly. I did do another video a few months ago about durable medical equipment or DME billing, and I've had some people ask some follow-up questions that have been really good, so I just wanted to do another quick video to kind of dovetail off of that one to hopefully shed some light on some areas so that you can start doing your own research when it comes to billing durable medical equipment. So if you haven't checked out my first video, please do that and then come back, watch this one, and hopefully it will shed a little bit more light for you, and then you can go from there. Let me preface this video again like I did in my last video. I am not an expert biller, especially for durable medical equipment. It's definitely a whole nother avenue of medical billing that usually people who are good at billing, medical billing, or they specialize in durable medical equipment billing, you would want if in your practice, if you're doing a lot of DME billing. If you are doing a lot of DME billing, this is something that should definitely be looked into, researched further. You should be asking experts further questions. I am not an expert in this field by any means. I'm just here to try to help guide you so that you can find that information. I will try to find some helpful links and put it in the description of the video so that you can utilize those, and hopefully that will lead you kind of down different paths of where to look. Oftentimes, DME is covered by commercial payers, but if you have specific questions and it's not covered in the contract in which you receive from the insurance, you need to reach out to them and ask them the specific questions that you have. And oftentimes their payer portals, once you are contracted, will have resources for providers for billing durable medical equipment, or when you call them, they'll be able to point you in the direction to look that up. Again, just like everything, every insurance is different. There isn't a one-all for everything when it comes to billing. DME billing for Medicare, again, like I talked about in my last video, you do have to be enrolled separately for DMEPOS billing, and you get a separate PTAN for that. Not all commercial payers do that, many don't, but again, you would want to find out and make sure, because you don't want to end up having all of this inventory of DME that you provide to your patients, and then you try to bill it out and you're not getting paid, because that's a lot of money up front that you're not getting back, or it's getting delayed, and it could cause some financial issues, especially in a startup practice. I encourage you, again, if you're doing a lot of DME billing, that you hire a billing specialist, coding specialist who knows their way around DME. Especially hopefully in your specialty, because every specialty uses different DME, right? So if you're an orthopedist, you're going to use different things than most likely a podiatrist does, and there'll be some overlap maybe there, but definitely going to be different than maybe an urgent care or a neurologist or pain management. So you want to make sure that you are hiring somebody that's familiar even with your specialty. DME would not hurt. The key to billing DME is, one, making sure that the patient's insurance covers it, that it's a benefit for them. Two, that you're communicating that coverage to the patient. So if it goes towards deductible, if there's a certain co-insurance, etc., that needs to be communicated. Knowing if it's purchased or if it's rented, that makes a big difference, or if the patient gets to choose. The codes that you use on the claims to bill DME are the HCPCS type 2 codes. So they have special codes related to the DME, and it's very specific. Like for crutches, there's wooden crutches, there's metal crutches, there's some that attach in the forearm, there's some that go underarm, and you need to make sure that you're using the right CPT with the right description of the DME you have on hand or that you're ordering for the patient. The other thing is you have to make sure you're using the right diagnosis code that is showing medical necessity for that specific DME or that durable medical equipment in which you're giving to the patient for their treatment or that you're ordering for them. The last key piece to all of this, when it comes to what the provider's responsibility is essentially, right, using the right CPT code, using the right diagnosis codes for those codes, is making sure that you're documenting appropriately the medical necessity behind the ordering of the DME. That's where a lot of people fall short, is they'll just say sprained ankle, gave a walking boot, blah, blah, blah. But it needs to be a little bit more than that. You need to explain why they need the walking boot, what was found, what is it going to help, what is the goal of using this piece of equipment going to do for the patient. The more detail you can provide in that, the more likelihood it's probably going to be covered, because oftentimes they will be asking for those medical records to complement that claim. Especially if you're billing out a lot of DME, you're going to get audited. It just happens. And they do different kinds of audits on DME. They watch it very closely because it can be very expensive. So you just want to make sure you're really covering yourself when it comes to documentation and the way that you're billing. I hope this helps. Again, any links that I can find that I feel will be good general resources, I will put in the description for the video. But just keep in mind that this is a very specialized area of medical billing, and you do want somebody in charge of this in your practice who has the knowledge base, has the experience. They're not learning as they go. That will definitely have your best interests at heart when they're doing this. As always, smash the thumbs up button if today's video was helpful. Subscribe to my channel if you haven't already. And as always, please share this with anybody who you feel will benefit. Take care of yourselves. We'll talk to you soon. Bye-bye.